Hello everyone, welcome back to my YouTube channel Learning with Morra. I am Pawan Morra, 1V20 IS 030 of Department studying in 4th year engineering from SVC Bengaluru. Today we will be discussing about the big data analysis and subject code is 18 CS72. In this particular subject, we will be mainly discuss at the big data in medicine and its some other features also. Without further delay, let's get into the topics. Yeah, welcome back. Why big data in medicine? The data generated by hospital or health insurance companies are becoming bigger and complex. Data are in the different format from human genetics to routine clinical documentation, from internal imagination to motion captures, from digital epidemiology to pharmacokinetics and from the treatment pathway to life course assessment. Data science have improved the healthcare industry from understanding diseases to better diagnosis and helping a patient monitor their own condition. Source of medical data. The clinical trials data for clinical research can be achieved using electronics health records are a web-based system. Each are designed to store a range of data, demographics, medical history, immun- immunization status, lab test result, radiology images, all those etc. Its reduced data replication and records can be shared through network connected. Big data is the tools for medical science, just like stethoscope, ECG, or a thermometer. We can collect data like heart rate, temperature, body chemistry, weight using medicine instrument. Big data in different fields of medicine, electronics health records, hospitals, aged care, allied health, pharmacy, pathology, general practice, specialist, all the things. How big data is being used for medicine? Clever uses of data to make better decision for medical science and health industry. Monitor the safety of drugs treatment, better understand diseases and develop drugs and treatment that can be change the life. Some EMR system automatically monitor clinical event by analyzing patient data from an EHR to predict detect events. Social media globalize, globalized health important source of the health data. We can collect heart rate, body temperature, weight, height, body chemistry, ECG data. Without frame of reference, this data is not be medically analyzed until we have a better understanding of what can be considered normally. Big data is disruptive technology for medicine. Radical change in the healthcare due to advance in genetic medicine. Data science is a driving force in disruptive technology born of genetic medicine. Big data is going to revolution the health industry by advancing the way of treatment, monitoring, diagnosis, and medication. It big data has not become so much useful to the health industry as we are expecting, and many medical traditionalists think that data science can never replace human institution and institutions for doctors. So the big data has yet to revolutions the health industry. Problems with using big data. One of the biggest problem around big data and the predictive models that could build on that data really centers on how you engage other to benefit from that information. Beyond the tools that we need to engage non-computational individual in this type of information and decision making. Training is the way to handle this problem. What big data means to patient. Big data is medicine can build better health profiles and better predictive models around individual patients so that disease could be better diagnosed and treated. Futures for patient in engaging engaging them as a partner in this new mode of understanding their health and wellness better and understanding how to make better decision around those elements. Most of their data collection will be passive, so individual won't have to be actively every day or logging things. They will agree to have their data used in this way because they get some pers- pre-received benefit. Extent to which big data make a difference in medicine. Drugs maker use big data to improve allergy medication supply chain technology to make sure that products are in stocks. They have advanced their supply chain technology and are able to combine data from thousands of stores and compare the information with other data to ensure they are meeting customer demands. Even some companies use real time data sources like Google Fly Trends, Twitter Trends, and temperature forecast to predict when product will be in high demand. There is some web-based software that help drugs maker to review data reports which are customized, available, can be analyzed daily. Cancer genomics data sequencing using big data to advance breast cancer risk prediction. Cancer genomics DNA sequencing using big data to advance breast cancer risk prediction with more than 230,000 new cases of invasive breast cancer diagnosed every year according to the American Cancer Society. Big data can be new tools that may help diagnose and treat breast cancer more effectively. Processing medical data generated by various clinical trials, genomic sequencing, and individual case studies promises to unlock a secret that could not be readily observed by human eyes. Prediction of prediabetes. Google is planning to tackle diabetes with the help of big data analytics and innovative Internet of Things technologies. Using data analytics, we can create a sample model for the doctor that could predict pre-diabetes patient would gain the most from a treatment with the drugs that prevents diabetes. The researcher used data from 3K peoples from an area as a clinical trials of diabetes prevention. The diabetes prevention programs including a variety of different health factors such as blood sugar level and waist to hip radio. Even by combining Google's interest in mini authorized medical devices that contribute to real-time patient monitoring. Google to tackle diabetes using big data and Internet of Things. The companies previously explored the development of of a contact lens that continuously measures a patient blood glucose with a little active effort. The lens would theoretically eliminated the need for the finger pricks blood glucose test while ensuring that the patient are constantly monitored for a dangerous fluctuation. Google was generated a patent for the device in March of 2015, though a representative declined to state whether that meant the lens was approaching market readiness. Big data as a future of a medicine. Pain medicine tap big data to save lives. Pain medicine modern. Big data initiative application alert doctors of at-risk patient pain plans to take the platform open source for other healthcare providers next year. The potential to deliver better healthcare has been one of the driving factors behind the push for big data analytics in medical in recent year. Future of a early cancer detection using microRNA detection platform for the molecular data gathering, analyzing and interpretation. Small RNA molecules found in the blood reflection reflect a person health status. The Data Lab Cancer Information Programs projects. The project is funded by Data Lab, Digital Health and Care Institute, and Stratified Medicine. The objective of this project is to develop a prototype cancer intelligence systems directed towards fulfilling the need of cancer patient and clinicals in clinician in improving care and outcomes for patients by combining and exploring existing data sets and unstructured information source. It is envisaged that the CIS shall generate new insights into patient outcomes and clinical treatment and outcomes in the Scotland. Thank you.